those three classes are yeah, y'all be up, honey. But it be early for y'all, so that makes sense. I remember when I was in California, I got up every like I visited. I'm a Miami girl, but I got up every day at 2 a.m. Um, I'm wondering if I should put more lighting. Chicago's only an hour earlier. Well, the people was up. You hear me? Yeah, so the new class is going to be a combination of legal aspects of healthcare and health policy. And it's going to be called, drum roll, please. Do I have a drum roll on here? It is going to be called Healthcare is Politics. So I'm trying to decide. The video is going to come where I'm going to tally up votes. I'm going to make it like a thing where I probably post it at least once a week until the end of this semester so that this way I can have an idea of when I'm going to teach it. If I teach it in the summer, it will be a 6 week class. If I teach it in the fall, it will be a 12-week class. Fingers crossed that I get a job in the fall because then I can really put the class together and just let it automatically run as opposed to going on live. Like I'll still go live because I like going live. I like talking to y'all. I like getting on here and the interaction. But I have a few contracts lined up for the fall. That's okay. She said I did a story time about a conversation I had to have with my primary. Ooh, I gotta check that out. I gotta check that out. You wanna get in here on the live? You could click I think you might have a request button. You could just click that and I'll invite you in. But yeah, even me, I had to fire my primary. Let me see, guess. Accept. Oh, that was cool. Let's see.
Hello?
You
Can you hear
on.
me?
I
Okay.
can hear you.
Hi,
Loud
everybody.
and loud
I
and
did a
clear.
story time because I had, long story short, I had a stroke last year and I'm
Oh,
only
sorry to hear
45.
that. Sorry
Some
to
of
hear
the
that.
factors, thank you. Some of the factors were my fault, and then some of the factors were, whatever. So,
Hmm.
long story short, I have a pill anxiety because I grew up watching my caregiver take pills for everything every day.
Hmm.
So I was like, I don't want
Girl,
that
me
to
too. I'm
be my
sitting here
pill.
right now with cramps and I won't take something
Right.
because
Right. And so I let my doctors know from the onset, like it started with anxiety disorder, and I was on no medication, and then I had to take one medication.
okay.
So I was reluctant to take the one medication because I know how that gets out of hand. So I've been telling them this, for years since that whole thing started. So then they changed me to another medication, and that medication caused weight gain. So after that happened, now all of a sudden I have diabetes. Now all of a sudden I have high blood pressure. So my doctor, fast forward, she had me on three different blood pressure medications,
Mm-hmm.
knowing that I have pill anxiety.
Okay.
So I wasn't taking them. And I had the stroke. And so I knew the importance of, making some changes. So I like holistic medications and like
Mm-hmm.
the holistic approach, and she knows that as well. So I changed some things with my diet and all that stuff. And then the other weekend, I started experiencing nosebleeds because I was under like a lot
Oh,
of stress.
yeah.
But I have never had a nosebleed before. And since I had the stroke, I figured it was connected. So I was concerned.
Mm-hmm.
So I called my care team and they told me what to do. The nosebleed stopped. A couple days later, I had another nosebleed, but this one was worse. So I ended up calling the paramedics. They took me to the ER, all the things. So when I was in the hospital, they prescribed one medication, and that medication did the job. My blood pressure, was under control and all that stuff. So, of course, after you go to the hospital, you have to go back to your primary.
Mm-hmm.
So, I went to my primary and I explained to her, I now see the value of taking medication and I'm willing to commit, because you had me prescribed to three. The likelihood of me taking three different pills every day for
Would be
one
too. It's too
condition,
overwhelming.
I'm not going to do it. Like, just being honest, I'm not going to
Yeah.
do that. But I can see the value of the medication and keeping my blood pressure under control. And I can do that with one medication. So I'm willing to do that. So she got her feelings hurt and she was like, well, do you want another doctor and blah, blah. And
Yes.
I was like, no, because honestly, she was amazing. She
Okay.
did everything that she could do.
Okay.
What she didn't do is truly educate me on what high blood pressure is, how it affects your body.
Mm-hmm.
Just using these terms, oh, hypertension, stroke, heart attack, that doesn't connect because I don't see the value in taking the medication. If I think that I can change my diet and exercise and that still not be enough versus taking three medications. So
Mm-hmm.
I explained to her, and she was like, well, what changed? And honestly, what changed was I took a psychology course that I'm in now. Thank God this is the last week of that class.
That's why I be telling
But,
you to educate, but education is so important. And I don't know if you got
mhm,
my book, Nevertheless She Breastfed. It's not really about the breastfeeding portion. It's
okay.
about the disparities that actually happens when you are not as educated and then you become educated.
Hmm.
Right. And so I'm glad you bring that point because to take a class and then that's really what changes
Right.
is amazing.
Right. Because, they say, you hear all the time, and I've been hearing since I was a child,
Hmm.
Black people have high blood pressure, Black people have hypertension. I
Hmm.
never knew what that meant. Like, that could be, the sky is blue. I
Yeah.
don't, how does that connect to me?
It's not broken down, and that's another thing. Like the last 2 weeks of the class that I've been teaching here on TikTok live is where we've been going over what the statistics are, because of course it's called racial disparities in healthcare. A
Hmm.
disparity is pretty much a lack, right?
Right.
There's a
Hmm.
lack, and so we have these lacks because of our race. There's some aspects that we can get around, like we could make more money, we could get more education, but essentially there's other things. There's implicit bias where
Hmm.
it's not necessarily that they racist or the doctor might be racist. They might just have an implicit bias. So if they know what your background is or know what kind of work you do, they automatically assume that you are in an educational bracket where you can
Hmm.
know it. It's just that simple.
Right. And then, like, because my issue with healthcare, and I have straightforward conversations with my doctors.
Hmm.
And what I don't like, and they won't necessarily address, is because, they talk about everything like data and this and that and your
Hmm.
BMI. Well, is the BMI accounting for my culture?
No,
Because
I'm
if
gonna tell you
I
right now.
weigh,
No, doctor health
no, I
scientists,
know this. I know this already. You know what I'm saying? But I'm
yeah,
asking them to let them know
they're
that
not
I
in
know.
research.
Hmm.
They're not in
But
research.
you're telling me, if I'm a Black woman and I have breasts and hips and I weigh X amount of pounds,
Hmm.
you're putting me on a BMI for somebody who is Caucasian who doesn't have the same
Hold on.
body
I'm
structure.
let me add to this. It's actually
Okay.
Caucasian men.
Hmm.
That's it.
That's even worse.
That's it.
Hmm.
My hematologist was the one who told me that. But when he told me, I had already known. I had already written the papers on how um the work that it would take to restructure the design of all of the numbers,
Hmm.
all of the genetic markers, all of the blood markers. Like it would take a whole revamp of a system to do
Hmm.
that. So
Right.
when we look at things like I think about the pamphlets that you get when you get a medication, right? You want to
Hmm.
look at, yeah, they give you that short pamphlet, but you can look more into the study and see how many black people were actually in that study, how many
Oh,
Hispanics were actually in that study.
okay. I
You
never knew that.
Yeah, it's
Hmm.
public record. It's public
Okay.
record. But then there's
Hmm.
the other part to it. Somebody asked me a good question. How do you decipher good quality research? And so
Hmm.
I've been sharing, if you catch up on the YouTube, I've been sharing how to find good quality research because again, with what we're seeing in the current administration and administrations before,
Hmm.
I holistically like to let people know this is not the first time this has happened.
Right.
Okay, this is not the first time, but this is a time where many of us are now a little bit more educated or making a little bit more money or struggling a little bit more, but we have to find ways to educate ourselves.
Hmm.
And so to be able to say, hey, this is where you can find peer reviewed actual research. If you find something good that you connect to, print it.
Okay.
We have to get in a place where we're getting back to physical media, because digital
Yeah.
media, as you know, and with AI and chat GPT and all of this thing, all of that essentially, when I say all of that, is like what that got to do with healthcare, everything, because all it
Right.
is, I have research that I did back in 2015. You can't find those articles now. They're sitting in my file cabinet.
Hmm.
I go look up those articles, I go look for those professors, I go look for those doctors and those PhDs. You can't find it.
Okay.
So you definitely want to, I'm glad. What you getting your degree in?
Psychology and philosophy.
Oh, that's a good one. Is a
Hmm.
master's program?
I'm in undergrad.
Oh, it's fine. Listen,
Yeah.
listen. Undergrad listen. That is fine. Keep going. Keep going. Keep
Thank
going.
you.
But
Hmm.
also, like, I teach undergrad too, so it's like I always would tell my students, like, you want to be sure to, like, whatever you take from the experience of undergrad. It's not like undergrad like before. Undergrad now is like whatever you take from the experience, you want to really hold on to it tight, because
Hmm.
again, they're pulling information out of the research.
Right. Okay.
They're pulling information out of the research. So get in the habit of, like, yeah, physical media, like digital. I know a lot of universities, for cost effective reasons, they put a lot of books in digital platforms.
Right.
But
Hmm.
it's like me, I be on Amazon. Let me buy the physical book.
Right. Like in
Let
my
me build my library.
philosophy, right, in my philosophy class, that
Look,
class, and it's funny because I did not know that so many different aspects of study, they have these hidden math components in there
hmm
that you wouldn't expect. And so, like my philosophy course, there's no book. He just provides the text to read. But my tutor, I had to get a tutor. So my tutor has a book that has that stuff. So I've been trying to find it outside of Amazon, but I think I'm gonna have to get it off of Amazon.
what's the book? Who's the publisher of the book?
I didn't look at the publisher, but the name of the book is Introduction to Critical Thinking by Daniel R. Kern.
You might could find the book directly through him.
Okay, I'm a, and
So
he teaches at my college, so that might be easy.
okay, yeah, you might be able to find the book directly through him. Try Google. Google Books has.
Okay.
I know people are shifty, shaky with Google, but Google Books is a good one. Thrift books, you might can find maybe somebody like.
Yeah, they have it on there. I just never used them before, so I'm
They're
very
good.
leery
They're
about
good.
different
And depending, you say Daniel R. Kern, but he teaches at the school. Yeah, ask him how
mhm.
can you buy the book directly from him. So
Okay.
he's in research. But another nugget I'll leave you with. When my doctors, I typically like to find my doctors who have a PhD or an MPH, a Master's in
Okay.
Public Health, because
Hmm.
they've done the extra research to understand what we talked about last week: vulnerable populations. And so
Okay.
vulnerable populations is me and you, it's
Uh-huh.
anybody else on the live,
Okay.
vulnerable
Okay, that's
populations
good
isn't always somebody
information.
who's homeless or unemployed, but vulnerable populations, when you look at, because you're studying psychology, so you'll get to a point where you start to learn the different psychology and sociology to me kind of go together.
Yeah.
And so once you start to look at like vulnerable populations, who's in the vulnerable population? Children,
Hmm.
single mothers.
Hmm.
There's so many different. It's such a big category. Like I could go on that topic forever.
Right, because so many things make you vulnerable.
There's so many things.
And like what I was explaining to my physician was like she, used the terms, but she never truly educated me on what hypertension is and how it truly affects you. And I'm a person with,
Hopefully going forward, she can take what you said to her and really use that to elevate who she is as a physician too.
right, and I think that that happened because now that I came to the understanding, okay, blood pressure, I understand how it works, I understand how it affects me, and all of those things. So now I'm in a position, let me get all of my health together. So
Okay.
now we got blood pressure under control with one medication. Now let's focus on this diabetes. Thank you. So, let's focus on this diabetes. So she literally like took out a piece of paper and like drew some diagram and like
Oh, good.
explained this is how this goes, this is how that, and that is the type of doctor that I need. I don't know about, other people
We
and,
all
because,
need that. Listen, we all need that type of doctor because guess what? We entrust our health to them. But then
right,
on the other side of it, how are we going to entrust that what they are doing for us or what they are telling us is good? We have to be able to advocate for ourselves.
exactly. And that was what I was most proud of, was advocating for myself,
That's a
because
big
I know
feat.
a lot
Congratulations.
of, thank you. Because a lot of people, I've seen people, they'll be like, the doctor told me to take this. I don't necessarily know what it is. I don't know what it does. I don't know how it affects
I
me, but
talk
I'm
to
gonna
them
take it because they told
recently.
me to.
I'm like, you'll have somebody come, and I work in vision care too. So a lot of times when people are complaining to me about the things that's going on with their eyes, and I'm like trying to find them, the right solution, right glasses, lenses, options. And it's like, are you on
Hmm.
any medications? Yeah, I'm on medications. What medications are you on? They don't know the names of these prescriptions, and it's like, oh
Hmm.
God, I kind of need you to know because that's going to determine what else is going on with your eyes. And do I need to recommend you instead of an optometrist? Do I need to recommend you to an ophthalmologist? Or
Right.
I do these other things where I created a meal plan guide through my master's program, and it was my professor, my doctorate program, and my professor recommended that I get it published, so I got it published.
Hmm.
But essentially, through that meal plan, I created a wellness assessment. And the wellness
Okay.
assessment looks at the 7 areas of wellness, which is not just your physical and your nutrition, but your spiritual, your environmental, like the things
Oh,
that we
that's
know to be our
good.
social determinants of health, right? Because there's
Hmm.
certain things
Okay.
that can deter us from getting good health care, whether it be access, whether it be money, whether it be poor health care conditions, because having access doesn't always guarantee you quality health
Right.
care,
That's true. Hmm.
right? And having quality health care doesn't always guarantee that you are a compliant person, or maybe you don't understand what's going on, or maybe there's a
Hmm.
cultural barrier.
Hmm.
A few students have told me, a few participants of the class I teach on TikTok have mentioned, they notice in their area there's a lot of new doctors and the doctors are disconnected. And I had to tell them, I said, as somebody who's worked with medical students, a lot of the newer medical students, they want to help,
Okay.
but a lot of the new medical students don't look like us.
Right. Hmm.
And so they go into these communities. When you think about police officers, you have police
Hmm.
officers who go into the roughest and toughest of communities and they grew up in the nicest of areas.
Right.
So
Right.
there's already the implicit bias there that has a fear, right?
Right.
All of
Hmm.
that goes back into health and wellness and
Right.
stress and anxiety.
Right. 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 Because I am a person with very high stress. Um, and then like everything causes me stress. Like I'm very type A and I'm unlearning being a perfectionist. So there's a lot of stress. And people think that like everybody doesn't present the same way. And
Mm-hmm.
I'm also a person who's asymptomatic. So these things are happening inside my body and I feel, quote unquote fine until my nose starts bleeding.
Oh
You know
wow.
what I mean?
No, that's like my daughter. She has anxiety induced eczema. So
Hmm.
when
Me too. Hmm.
she's like, "Oh, I'm not anxious because the body is the nervous system. The nervous system is, the hardwired. That's your plug. So
Hmm.
something going on there, but it's going to affect your thyroid. Your thyroid is affected. You could in turn trigger. Unfortunately, you had a stroke. Like things like that happen. I've had
Right.
patients in the past. I had a quick story time. I'm an optician, so I fill the prescription for glasses and contacts. That's what I do outside of other things. And when I was working in a practice, this lady came in and she's like, I saw a flash of light, and it our doctor wasn't in, and I was like, girl, you need to go see an ophthalmologist. And I always wondered if she went, and she came back to me a week later and she's like, you were an angel in disguise. I'm glad you forced me to go because I didn't think it was that serious. She was having a
Hmm.
stroke. She was having a
Right.
stroke in the back of her eye.
Hmm. And the thing, and I'm glad you mentioned that because when I had the stroke, I didn't know I had a stroke.
What?
I was driving and I was like,
Did
my eye is a little bit weird. Like, I thought maybe
you
I'm
felt
just
like it was
tired
closing
or
in?
No, it was like I was starting to get double vision.
Mm.
And so I got where I was going. Thank
Okay.
God I was going home. And I was like, something's going on. I don't know what it is.
Mhm.
So it was after hours, so I couldn't, and it was my eyes. So the first thing I thought was call my optometrist. But like I said, it was after hours. So the next day I called my optometrist and let them know, I was having double vision. And so I went to his office and he, did his thing and all that. And he instructed me to go to the ER. And he didn't
Mhm.
like verbally tell me, but he gave me this paper. And so I read the paper and it was like for a stroke assessment. And I was like, what? I didn't feel
Different.
nothing. I just got, this
Yeah.
double vision, which is weird. And
And
sure
it's the
enough, I
silent
had had a
killer.
stroke.
It's the
Hmm.
silent killer, and I believe. Let me look at my notes. I just had told him last week. 2 weeks ago we was talking about that, and it was like, yeah, that's number one.
Hmm.
It's number one in African American women. We carry so much of the brunt and the weight,
Hmm.
and life, and a lot
Hmm.
of the going back to the triggers that we are born with and the stress that we're born with, like
Right. Hmm. Absolutely.
the
And
things that
so
we
I
saw
just,
as children, all of that, it doesn't ever really go away. We just learn
right.
to live around it until it
Hmm.
bottles up and explodes on us.
Yeah. Hmm. And so since then, I've been kind of vocal on my platforms about like health and wellness, and especially like that's why I did the TikTok story time
Mhm.
about the interaction that I had with my doctor, and I kind of explained like my criteria of when I um, accept the recommendation or when I
Mhm.
question the recommendation
What
and all of those
platforms are
things.
you on? Because I'm gonna download this live, and I'm gonna upload it to my YouTube.
Oh, okay, thank you. So I'm on obviously TikTok, and then Instagram, and I have a blog.
Oh,
Well,
cool.
I have
DM me
a
all the
couple
links for
blogs.
that because I'm gonna post this to YouTube.
Okay, I'll put it in your I'll send you a message when we're
Yes.
done.
Yeah, DM
Uh-huh.
me all your links, and I'll
Okay, I will.
definitely put
Thank
this
you.
on YouTube. And it's really been a pleasure talking with you. But yeah,
Likewise.
I look forward, to your future successes
Thank
and
you.
you reaching all of your milestones in your health. And it's a small thing to beat. You got it, girl.
Thank you so much. And I'm doing things. I changed my diet. I've now incorporated a Mediterranean type diet.
Okay.
And so I'm leaning towards like Mediterranean and Japanese diets.
Oh,
Um, for
and
like,
walk a mile a day. I've
I
done this.
joined the gym.
Yeah,
Hmm.
I've done this challenge for maybe 3 or 4 years. It was something I started on Facebook. And really, let me tell a little backstory. I started
Hmm.
walking a mile a day in an effort to combat seasonal depression.
Okay.
So I would start walking a mile a day, typically in September, and I would carry it through the end of the year.
Okay.
And it worked. And I was like,
Hmm.
oh, shoot. And so when I was telling people that's what I was doing the next year, I created a Facebook group and there was people who were joining in. And so I don't need anybody to hold me accountable, I'm gonna be honest with you. But
Hmm.
people needed me to hold them accountable. So it's like, hey, did you do
Okay.
your mile a day? Did you do your mile a day? And so people were doing their mile a day and um sharing their successes in, hey, yeah, I was dealing with this and just walking a mile a day. And honestly, once if you don't typically walk a mile a day, it'll probably take you 30 minutes. Before
Hmm.
you know, you'll be doing a mile in 10 minutes.
Hmm. Yeah, because when back in the day, when I was a bit younger, I used to literally walk 5 miles a day, and it was
We
like
used to
a
walk
cakewalk.
everywhere.
And
I used
so
to
now
walk
I need to
everywhere when I
get
was
back
younger.
into that. Hmm.
Yeah, I was like, I used to walk everywhere when I was younger. And it's like I was walking when I had no choice. Now I have the choice to walk. I better use it.
Right, right. I agree. So I'm getting back into it. So thank you so much for your encouragement
No
and the nuggets
problem.
that you shared. And I'll definitely send you a message when you
Yes,
finish
it'll
your
be
live.
on YouTube. The YouTube is Black Girl Say Something, and we have a
I
podcast.
think I follow you
Say
already.
Something. All right. I look forward to your message, and I'll get this off on
Okay.
YouTube.
Okay, thank you.
You're welcome. Later.
Later.
It's time for bed, y'all. Y'all getting ready? I'm doing my Duolingo. I'm gonna have to get off and come back so I could download this live.